This was a heavily pretreated population of patients. So on average, patients had had 3 or more lines of therapy. So really, this was fourth line for most patients. But we know that once we hit sort of third line and beyond, the available options for follicular lymphoma and marginal zone lymphoma, once you hit third line and beyond, that's when the remission durations start to get shorter and shorter. So the number of CRs are generally lower, and the patients are expected to relapse before a year of that line of therapy. So the fact that we saw so many complete responses and that so many are ongoing past a year is already an improvement for patients in this line of therapy. Now, not every follicular lymphoma patient will get to a third line of therapy. Many patients, have this disease for 20 or 30 years. They can be observed for a while. They may only need 1 or 2 lines of therapy in their lifetime. But for that group of patients who gets to the point of needing a third line, we do need treatments that can give more durable responses. So I think that's what we can say that's what we can say right now. I think we need longer follow-up in this disease because this is a disease that is known to respond for multiple years to a therapy and has a high risk of relapse. And these relapses can happen late, and what that really means is that with conventional therapies, these are incurable diseases, and so it may very well be true that these patients in ongoing response at this point, are at risk of relapsing as time goes on. But if they don't, then we've just discovered a therapy that could turn an incurable disease into a curable disease for a subset of patients, which would be remarkable.